In recent months, there's been a lot of talk about the future of Medicare. We are reminded of what's really at stake when we have this discussion. It's not about overheated rhetoric at election time. It's about a promise this country made to our seniors that says if you put in a lifetime of hard work, you shouldn't lose your home or your life savings just because you get sick. Over the last 48 years, millions of Americans have worked for that promise. They've earned it. And for many seniors, the care they've gotten through Medicare has made all the difference in the world. That's why our goal has been to strengthen Medicare now and preserve it for future generations. Today's seniors deserve peace of mind, and the millions of Americans who are working hard right now deserve to know that the care they need will be available when they need it. The goal of healthcare reform should be to reduce cost growth within the health system while protecting the essential benefits that Medicare covers. The Affordable Care Act of 2010 laid a solid foundation of reforms to transform Medicare into a program that rewards value and quality of care instead of quantity of care. As part of the Affordable Care Act, we gave seniors deeper discounts on prescription drugs and made sure preventative care, like mammograms, are free without a copay. We've extended the life of Medicare by almost a decade. And we proposed reforms that will save Medicare money by getting rid of wasteful spending in the healthcare system and reining in insurance companies, reforms that won't touch your guaranteed Medicare benefits, not by a single dime. Conservatives in Congress have put forward a very different plan. They want to turn Medicare into a voucher program. Their plan places the risk of rising healthcare costs on the backs of seniors and individuals with disabilities. The conservative plan does this by capping the rate of increase of the voucher payment to individuals. Over time, this payment can grow no faster than the increase in per capita GDP plus 0.5%, even though healthcare costs are expected to rise at a much faster rate. That means that instead of being guaranteed Medicare, seniors would get a voucher to buy insurance directly from a health insurance company, but it wouldn't keep up with costs. As a result, one plan would force seniors to pay an extra $6,400 a year for the same benefits they get now, and it would effectively end Medicare as we know it. As a result, people who rely on Medicare will face a terrible choice. Either they will no longer be able to afford the health benefits that are currently provided under Medicare, or they will be forced to pay much more simply to maintain existing benefits. Either way, the conservative plan violates the Medicare guarantee. Conservatives often say their Medicare voucher plan is just like what members of Congress get as federal employees, or that it is like the Medicare Part D prescription drug benefit. These claims are simply wrong. In these two programs, the federal government commits to paying a fixed share of the total cost of premiums for an individual. In other words, the federal contribution keeps pace with growth in healthcare cost. This is a fundamental difference between the conservatives' Medicare plan and the health plan available to members of Congress. This is why the conservatives' Medicare plan is a voucher plan, not a premium support plan, as they claim. In a true premium support plan, the government commits to paying a constant, fair share of the total premium, rather than gradually reducing the federal share and increasing the beneficiary's share over time. With their embrace of this plan, conservatives are demonstrating that they are willing to place much more risk on seniors than they are prepared to impose on themselves. Conservatives are committed to ending Medicare as we know it. As you heard Jean say, they even want to make it easier for seniors to not be a part of Medicare and let them purchase health insurance on their own. We cannot allow wealthy seniors to just opt out of the responsibility to be a part of a program that helps bind us together as a nation. We need to strengthen and preserve Medicare for today's seniors and for future generations, not undermine it.